what about a person who has apparently some tendency of cracking or tipping his ankle, like he walks and it kind of, what about that? Meaning he's not balanced, like a little bit of car being out of alignment and it keeps yanking like that?
It's an excellent point, and that's actually a very common problem, usually attributable to a very specific muscle weakness in the ankle and in the leg. And there are a number of very specific orthotics designed to help with that problem. And there's a couple of ankle braces per se, but there are some very, very specific orthotics 100% designed to treat that exact issue. And I don't care how active you are, how young or how old, this is a type of device that you can play basketball in, you can play baseball in, you can do anything in it. And that ankle instability, as we would call it, or ankle weakness, it's a thing of the past after that. So yeah, excellent point, excellent question, and a great resolve for it.
And a good answer, thank you. So what about, maybe it's the same and maybe it's not the same. What about general balance? There's people out there, they seem to be having less general balance than other ones. I'm not, does it maybe potentially have something to do with the way, again, they stand? And the only reason I'm asking is because I keep thinking the car, which you mentioned, and I go, if something is wrong with my four wheels, I know my balance in my car isn't good. It wouldn't matter what good shocks it has in it. I mean, the good shocks might help. It may be worse with bad shocks. I get that. But, once and my car mechanic, 76 gas station guy, Bob, couldn't get more typical American. I bring my car there for, 18 years now. And, every time my tires get a little bit saying, and I go, they're still good for, he says, you're right. They're not yet exploding. First of all, you don't want to go that far, but he says, you're already having, less balance. And he knows I go skiing in the mountains and go curvy roads. He says, I go, really? That has to do? Yeah. He says, of course. Anything, same with the fit.
Again, another excellent point. It makes me picture the typical podiatrist's office. Somebody comes in with kind of a complaint like that, where they feel like they're off balance, or, their front or side, whatever it is. And in a typical podiatrist's office, we have a long hallway for a reason. It's not because we just like long, skinny offices, because we're going to watch you walk down that hallway back and forth and back and forth. And we're going to watch your shoulders, we're going to watch your hips, we're going to watch your knees, and we're going to be able to tell if something's out of balance potentially. And we'll put something in your shoe, we'll wad up papers and put them in your shoe if we have to, just to see if that slight change is enough to bring you back into balance, so to speak. But so again, by watching a patient walk with some of those symptoms, we can tell many, many different things about balance problems, postural issues, and an orthotic can make a huge difference in those cases.
Beautiful. So you just said something which I didn't even think of it in the beginning. I just kind of balance, and then maybe people go to a neurologist because they think they're dizzy or so, when they really just have, balance. Or they think, well, I'm not a sporty guy, I'm not a balanced kind of guy, when it's really, they're walking somehow not right. Anyway, you brought up something, I think as maybe more important, posture. Most of us, hopefully people don't get offended, but many of us for sure have some type of posture problem. And I'm not again asking whether every posture problem can be fixed, but did you just say insert can maybe make me walk a little straighter, and which in itself, I've heard if we walk slouched, we don't breathe so much, we don't circulate the brain so much. I mean, name it. So are you telling me an orthotic could maybe make me better looking, number one, and number two, because of it, be maybe having less neck pain, less shoulder pain, less whatever, because I'm not walking crooked?
All right, to start, I'm not touching point number one. I'm not going there, Helmut.
You mean
I don't want to offend anybody.
You mean the better looking one,
I'm not going there. Thank you. I'm not going there. We'll have a separate video on that.
Private. And I get a contract. How much better looking will I be after I come for orthotics to you? I get a contract on that.
Oh my gosh. All right, now I already forgot what the original question was.
Posture. Orthotics help posture.
Yes.
And by doing so, alleviate other problems, be it breathing problem, be it whatever.
Absolutely. Okay, so you picture this scenario. You put an orthotic, you put something inside of your shoe. And what that's going to do is instead of your feet being here, let's say to start, your feet are now here. Well, what does that do? Now the muscles are moving differently from here and going higher up in the body. So as soon as you put something, as soon as you make a change down in somebody's foot, guess what? It has to have effect. We're hoping a positive effect. That's the whole goal. It's going to have an effect on their entire mechanics from their foot all the way up to their neck. And as you and I have spoken in the past, there's articles that have shown a correlation between poor walking mechanics and TMJ. So what does that tell you? That whether the problem is up here, it affects this direction, or if the problem is down at the bottom, it affects this direction. So it can have a tremendous impact on mechanics and balance, because we're affecting every muscle from the foot all the way to the neck and sometimes beyond.
Well,
it's something that, you know what, it's probably hard to grasp that concept until you've kind of lived through the change of an orthotic. And that's probably the best way I can do it. It's pretty hard, but it's easy to imagine changing something in your feet. Yeah, you're going to change everything from the foot up to the neck potentially. Your muscles are moving differently. Your bones are moving. Your joints are moving.
Yeah, most of us probably do underestimate the importance on how a foot coordinates the rest of the body. I have heard that people who lose a toe, after that, even though nicely operated, and whatever, all, it's a world of difference. It's apparently much worse than losing your thumb or another finger, which, none of it is I'm sure pleasant, but apparently losing a toe is just a world of difference. And as we know, go and have a tiny little rock in your shoe and life becomes miserable. Or, like you mentioned, have a bunion. Anything which makes you walking more crooked. So some of those walking more crooked might hurt, so you know about it. But if you don't know about it, then it affects you nevertheless. And that's when orthotic, even for bunions, I think you mentioned, sometimes no matter what, evens it out, and then you walk straight again.
Yeah, absolutely. You just mentioned a point early on about losing a toe, and really it's about losing a big toe, and that's why if somebody does lose a big toe, one of the first things we do for their shoe, we put in a fake toe in their insert to act as a little more stability. You lose your big toe, you lose a lot of stability. It's amazing. So don't take your big toe for granted. You need it. You don't want to lose it.
Don't take the whole thing for granted. Dr. Kahan, we have to end this. We're running, way over, but it's just really too interesting, and I think too neglected by most of us. There it is. What's the foot for? To kick someone in the butt. We don't do that too often anymore. So it's basically a pretty useless type of thing, and then we are in trouble and don't know where our headaches come from and our DMJ comes from, and maybe are not breathing very well and slouching. I have to go there not looking good. Bye-bye, Dr. Kahan.
Thank you.